Hey, Dr. Schneider from the Pain and Wellness Center, and today we're talking about degenerated disc problems. You may have been diagnosed with a bulging disc, a herniated disc, or a degenerated disc. So these are the different stages of disc degeneration. This is normal, this is phase 1, this is phase 2, this is phase 3. So now I'm going to talk a little bit about how these discs degenerate. So what happens is people have falls and traumas, and those falls and traumas can affect your disc and can affect ligaments that you have on your spine. People oftentimes will even sit wrong or they'll bend wrong, and that causes injury to the ligaments of your spine. And you have a bunch of ligaments here, you have ligaments that go around the joints, you have ligaments in between the bones, and they can get damaged. And what those ligaments look like is this. So right here is a nice healthy ligament. You can see how these fibers are all uniform. The middle picture is a ligament that has some damage to it, and you'd start developing some fibers going in different directions. These are sort of like adhesions. And then down here you can see just how badly damaged the ligaments are. These ligaments are scarred. The big deal about the ligaments are the top picture you have nice flexible ligaments, the middle picture you have less flexibility, and the bottom picture you have like no flexibility. Why is that a big deal? Because when you deal with a disc problem, any joint that doesn't move properly, within 3 days you start to develop adhesions. And within 7 days you start developing scar tissue. And if you have adhesions and scar tissue, the joints don't move. So we're going to talk about why that is important. So this is your normal disc. And if you look at your normal disc, you have this nice fluid-filled area here. These are your annular fibers. In the center you have this thing that looks like a gel. That's your nucleus. The way this disc stays healthy, though, is with movement. So you literally pump fluid in and out of that disc, and the fluid that is pumped in and out of that disc actually comes from the bone and the bone marrow, and there's this little barrier here that the fluid forms in. However, if you develop scar tissue in the ligaments here and scar tissue in the ligaments here, you're not going to have that mobility, and the joint will not move as well. If the joint does not move as well, then you start seeing dehydration. You can see how these fibers start coming apart here. So this is a dehydrated fiber. You see it starts separating here. In this level, you start getting some bulging of the disc. So this would be considered like a bulging disc here. The next level is these fibers continue to degenerate. You can see how this red stuff is called the nucleus starts protruding between these fibers, and these fibers tear in half and it protrudes out, and this is what's called a herniated disc. This continues to progress, and your disc gets down to this level. This is level 3. There's almost no disc left here, and you can see the nerve openings real small. That's the other part of this that you have to understand, is the changes that occur in the nerve. So right here you have this big opening. You can see this large nerve, and as this progresses, you can see here a smaller nerve opening, but you can also see how the nerve itself is smaller. So this is the nerve right here, and you can see this smaller nerve, and what the body's doing, it's adapting to this decreased space. And then on the other side where you have the herniation, you can see very little space. And when you get down to this level here, there's like almost no space at all, and you can see how badly damaged the nerve is. So that is disc degeneration. That is oftentimes what's causing your problem, so that gives you a better understanding about what it is. So the next video we're going to talk about how you can start reversing disc degeneration.